Now the recording is started. Right. So I welcome you all in today's class um on the learning outcome 2, which is for Unit 4, working in health and social care. And I'm your tutor, Sayyed Taj. And today's class is on effective communication in health and social care. And if you have any question, any one of you have any question, then please do ask and let me know, and I'll try my best to answer. So communication, we can say, is the foundation of everything we do in this health and social care field. Whether it's interacting with uh, patients, service user, their families, or other healthcare professionals, the way we communicate can significantly impact the quality of care. And our goal today is to go deep into the different forms of communication, understand the challenges we might face, and learn how to overcome them effectively. And we can say that it's essential to recognize the foundational role that communication plays in health and social care. So, throughout this learning outcome, we will unpack the various forms of communication, understanding that it's not just about the exchange of words, but about how those words are received, interpreted, and acted upon by the client, service user, patients, um, and their families, and the colleagues we work with. And effective communication is the thread that ties together all aspects of care. It helps us build trust, convey empathy, and ensure that the service user understand their treatment and feel involved in their care decision. And it's also what enables us to work as a team, ensuring that every service user receives high quality care. So we'll move forward and keep in mind that communication is both an art and a skill, one that can be developed and refined through awareness, practice, and commitment to understanding the needs of others. So, as we all know, that this unit is based on working in health and social care. So, the important aspect of today's lesson is on communication in health and social care provision. Now, we'll move on to the first slide. Right. Here we have uh, the indicative content. So the indicative content is the important content which we must have to cover um, in our learning outcomes, and these are related with the specific learning outcome, whatever we are studying. As in today's case, we are like studying the learning outcome 2, or we can say it learning objective. So we are doing the learning outcome 2. As I have discussed it yesterday in the first lesson, that this specific unit 4, has 6 learning outcomes to cover, and we'll go through with each learning outcome uh, in each session. And so we are focusing on the learning outcome 2. So uh, the objectives uh, which will guide our learning today is, the first one is understand why effective communication is important in health and social care provision. So effective communication is crucial in healthcare because it directly impacts the service user outcome and the quality of care. Um for example, if a nurse or a care provider clearly explain a medication to a patient or a service user, the service user is more likely to adhere to it. So what it will do, reducing the chances of complication. And on the other hand, poor communication can lead to misunderstanding, non-compliance, and even harm. Uh, if anyone of you working in the care sector at the moment, if we are working in health and social care field, so specifically if in a hospital setting by NHS or any private clinic as well. Also, if any one of you are working in care setting, so like we all know that how important is communication in health and social care. The second thing is we need to recognize the different forms of communication used in health and social care setting. So, uh, communication in healthcare is not limited to just talking. We will explore verbal, non-verbal, and written communication. Uh, for example, when we verbally explain a procedure to a service user, our body language, a form of non-verbal communication, also plays a crucial role in how the service user receives the information. Uh, we have written communication like the records of the service user, and it ensures that all healthcare providers are informed about their care, the service user care. So, are you all familiar with the records of service users by the form of, we can say, a care plan? So, we can say that when we are in a workplace, we do follow the care plan and we work according to it. We have the duty rota. Um, we have to schedule everything properly, and that's we do when we are working in the field. Then the third thing we have to uh, learn in this learning outcome is identify the barriers to effective communication. So in real world, healthcare setting communication is not always straightforward. Language differences, cultural differences, emotional states, and sensory impairments are common barriers. For example, if you are working with a service user who does not speak English fluently, they may not fully understand their treatment plan, uh, leading to poor understanding. And recognizing these barriers in this first step, we can overcome them. So I hope that when we are working in the field, when I was working in the field, like there were many service users who cannot speak uh, English fluently and they don't understand it properly, or sometimes they have difficulty in reading due to some medical ailments, or generally they are not literate that much, so that's why we face those issues. So what we do is we sometimes have an interpreter, and we try to explain them with our body language and things. We also note the body language of the service user as well. So the third point is uh, we need to learn the principles of confidentiality and how to handle information For confidentiality, we can say that it is very important in healthcare ethics. It's one of the kind of ethics, and it's about protecting the service user privacy and ensuring that their information is only shared with those who need to know. For example, discussing a service user's medical history in a public area where others might overheard would be a breach of confidentiality. uh, we will learn how to handle sensitive information properly to maintain trust and comply with legal requirements. Then we have to explore methods to overcome communication barriers and improve interaction. So once we identify the barriers, we need practical strategies to overcome them. As an example, using a professional interpreter when communicating with a patient who does not speak English ensures that the service user fully understand their diagnosis and treatment option. So we will look at various tools and techniques to make sure our communication is as effective as possible. Now we have to discuss some key terminologies. So, what are key terminologies? These are the important terminologies which we have to use during the lesson or the specific learning outcome. So, all of these important bits, like the terms we say that indicative content, key terminologies, or like uh, the guided learning hours or the credit values, these all will be same for like the concept would be same. The learning hours would be different, guided learning hours would be different, credit of each um, unit would be different, and the key terminologies and we can say that the indicative content would be different, but like the concept is same. So, like in this unit, specifically with the learning outcome 2, we have the specific key terminologies, and we have the key terminology here. What is effective communication? So, uh, what it does, it forms good relationship. So building trust is essential in healthcare, and effective communication is the key to forming a strong relationship with the service user. As an example, when a doctor listens attentively to a service user concern, it shows respect and empathy, which can make the service user feel valued and more likely to engage in their treatment. So this relationship forms the foundation of patient-centered care, or and it is very important in health and social care sector. So person-centered care would be applied. Then what it does also, it improves collaboration. So in healthcare, teamwork is crucial, and effective communication ensures that everyone is on the same page. As an example, during a patient's hospital stay, clear communication among doctors, nurses, and other healthcare professionals ensures that the patient or the service user receives coordinated care. Miscommunication can lead to errors such as administering the wrong medication, which can have serious consequences. Then we have all these important aspects. Mhm. Effective communication also requires the care worker to develop and use a range of skills, abilities, and communication techniques. Right. here we have to the learning outcome 2.1 is related with the describe the role of communication in health and social care. So as we have discussed earlier that communication is very important in health and social care. We have discussed that in every care setting, like communication is important, and here we have according to Cipher Health. So look, this is the in-text citation. So it was like written in 2022. So they say that there is a continuation of communication after the discharge, for example, change in medication, regular checkup, follow-up. So these all are important. So we need to discuss everything properly. So then the service user will understand that what they have to do. If we are not able to describe everything properly, then it would be a chaos and it would be a problem for both the staff and the service users. So then here we are discussing it like there are ability to listen and explain has a positive impact on experience of care and also leads to satisfaction. So we might have experienced it, and we also feel like I used to feel it very positively, and the service user also used to engage with me in a positive manner, and I feel very happy and very satisfied as I did my job properly if I am able to explain everything properly. So same I do with my students, like with the lectures. If you have noticed that mostly my lectures are not only for an hour, they exceed the stated time because I think that I need to explore and I need to share all the knowledge related with the slides or the learning outcome. So it would be easier for all of the students to understand them properly. And what I do is I try to explain it with examples. So the student would understand it properly if we relate it to the uh, daily life routine or at the workplace what we do. So it would be easier for us to understand with example. So same we can do with the uh, service user, and by that they will understand it better. And we have here, for example, they are giving us example of care workers use different forms of communication during their working day or night. These include verbal communication, skills of talking, listening, and various form of non-verbal communication such as touch, eye contact, and facial expression. So we have discussed that non-verbal communication is also very important. It's not only related with the service user. We also have to notice some forms of non-verbal communication by the service user. Sometimes we have to um, like um, um, notice any non-verbal cues from the service user in case of any harm or if we see any signs of harm on a service user. So what we do is uh, that is their non-verbal communication, and when we have to look for the signs, and then we will report it if the incident is uh, related with a significant harm something. So we have to be very careful about that in terms of the non-verbal communication by the service user, and sometimes we have to use the non-verbal communication with the service user. So we have to be careful about both the sides of non-verbal communication. And here, uh, and also one more thing, uh, we also need to be focused on the person-centered care, and effective communication empowers the service user to take an active role in their own care. When service users understand their diagnosis and treatment options, they can make informed decisions. So, as an example, a patient who understands the importance of lifestyle changes for managing diabetes is more likely to adhere to a diet and exercise plan, leading to better health outcomes. So, here we have to discuss about uh, methods of communication used in health and social care. Right. So we have verbal communication here. So, and non-verbal communication, written communication. So when we talk about communication, so communication in healthcare comes in various form, and each play a vital role in the service user care. So first one is verbal communication. So this is the most common form of communication involving spoken words. For example, when explaining a diagnosis to a service user, it's important to use clear, straightforward language. Avoiding medical jargons ensures that the service user can understand and feel comfortable with the information. And a simple phrase like your heart is not pumping as well as it should is more understandable than you have congestive heart failure. So sometimes those uh, jargons would be difficult for the service user to understand. Same like with the mm, studies, and as I told you that we have to use the indicative content and the key terminology. So I explain it what it is, and we have the terminology of guided learning hours or the credit hours. So I've explained that in my first initial lecture, um, when we go through with the assignment brief, like the structure of the unit, so what we have to cover, so things. So if I only use the jargon language, then the students won't understand. Same, it's with the service user. So as I have given the example that if I say to a service user that your heart is not pumping as well as it should be, so is more understandable than if I say that sir, or the person, we we say Mr. A, for example, you have congestive heart failure. So these are the things we need to consider. Then we have non-verbal communication. So, non-verbal communication includes body language, facial expression, and eye contact. So, these cues can reinforce or undermine what you are saying. Um, as an example, maintaining eye contact and nodding while a patient speaks shows that you are engaged and listening, which can make the service user feel heard and respected. And conversely, crossing your arms or looking away might make the service user feel dismissed or unimportant. Then we have written communication. So, written communication is crucial for documenting service user care and ensuring that the records are effectively maintained. As an example, when writing in a service user medical record, it's important to be clear and concise. A note like patient reported severe chest pain at 2 p.m. And given if we mm, mention a medicine, like for example, in that case, we can give nitroglycerin and monitored for 30 minutes. What it does, it provides vital information for any healthcare provider who later reviews the service user chart. So what it does, it ensures that everyone involved in the service user care has the necessary information to make informed decision. So On the other hand, if we only um, write in the notes that, for example, uh, nitroglycerin given, so what would happen? So what time we have given them, what dose we have given them, so why we have given them. So if we don't write it in the report, then it would be difficult for the other staff members to understand. So if we write a clear and proper notes, then that would be understandable for everyone. Now, right. Here we have to discuss about the sign languages. So British Sign Language is we need to discuss. Uh, right. So when we discuss about the British Sign Language, uh, we need to we need to know that British Sign Language is a crucial communication method for the deaf community. For example, when working with a service user who's deaf, using British Sign Language ensures that they can fully understand and participate in their care. And it's important to recognize that British Sign Language is a language with with its own grammar and syntax distinct from English. So when we follow the British Sign Language, what we do is we support the independence of the service user. So by using British Sign Language, healthcare providers can help deaf service user maintain their independence. For example, deaf patient might feel more comfortable discussing their health concern directly with their doctor using the British Sign Language rather than relying on a family member to interpret. So this direct communication fosters a sense of autonomy and respect. And there are some new technologies as well. So advances in technology are helping to bridge communication gaps for those who use British Sign Languages. For example, video relay services. So it allows deaf service user or patients to communicate with hearing individual through a sign language interpreter via video link. So this technology can be especially useful during telemedicine appointments or when a British Sign Language interpreter is not available. Then we have uh, some human aids to communication. So what it does, uh, we have human aids, we can say that play a crucial role in facilitating communication in healthcare setting. We have interpreters. So interpreters help bridge language barriers between service user and healthcare providers. For example, if a service user speaks only Spanish, a medical interpreter can translate the conversation and ensuring the service user fully understand their diagnosis and treatment options. Then we have translators. So translators work with written communication. So translating documents such as service user instructions or consent forms. We can say, as an example, a hospital might provide translated discharge instructions in patient's native language to ensure they understand how to manage their care at home. Then we have signers. So, uh, signer use forms of sign language like British Sign Language to communicate with service users who are deaf. As an example, in a hospital setting, a signer might be present during a doctor's visit to a we can say that to interpret the conversation for a deaf patient. Why we do that? To ensure they are fully informed and can ask questions. Right. Here we have to discuss about the signs, symbols, and objects of reference. So, signs and symbols, these are like visual aids that convey important information, specifically to those who may have difficulty for language or reading. For example, a hospital might use symbols to indicate areas like restrooms, emergency exit, or the pharmacy. So these symbols help the service user navigate the facility independently and reducing any confusion. Then we have objects of reference. So objects of reference are items that have specific meanings for an individual and often used with people who have learning disabilities or dementia. Um, as an example, a service user with dementia might recognize a specific blanket as a sign that it's time to rest, and using such objects in their care routine can provide comfort and familiarity, helping them feel more secure. Right. So again, here we need to discuss about the technological aid. So as we all know that technology has greatly enhanced communication in healthcare, especially for individuals with disabilities. So we have electronic communication. So these devices assist individuals who have difficulty with verbal communication. For example, a patient who cannot speak might use a tablet with a speech generation application to communicate with their healthcare providers. It allowing them to express their needs and preferences effectively. Then we have uh, hearing aids. So what they do is they amplify sound for individuals with hearing loss, making it easier for them to engage in conversation. As an example, during a consultation, a service user with a hearing aid can better hear and understand the doctor's instruction, ensuring they don't miss any important details. We have uh, we have video phones as well. Like we can use the uh, video phone services. Video phones are particularly useful for deaf service users who use sign language. For example, a deaf service user can use a video phone to communicate with their doctor through a video relay service where an interpreter signs the conversation, allowing for effective two-way communication. Right. Here, we need to discuss about the barriers to communication. Okay. So, look, this is again an in-text citation. Early in 2017 and Parida in 2022 have identified certain major barriers. So, for example, the first one is about condition of service user. So, the service user physical or mental condition can be a major barrier. As an example, a service user with severe Anxiety might find it difficult to focus on what the healthcare provider is saying. In such cases, it's important to approach the service user with empathy and perhaps breaking the information into smaller, more manageable parts. Then we have competing demands. So, healthcare providers sometimes face competing demands, such as managing multiple service users at once. So this can lead to rush or incomplete communication. Uh, as an example, if a nurse is attending to several patients simultaneously, then they might not have enough time to fully explain a procedure to one service user, leading to confusion and an anxiety. Then we have lack of privacy, right? So service user may be reluctant to share personal information if they feel they don't have privacy. For example, a service user might withhold important health details if they are being interviewed in a busy open area. So we need to ensure a private, confidential setting is essential for effective communication. Then we have language. So language barriers can uh, hinder the communication. As an example, a service user who only speak, for example, Chinese might not understand English instructions, leading to potential miscommunication about care. And providing a translator or translated material is crucial in such scenarios. Right. So here we have to discuss about gender. So in some culture, service user may feel uncomfortable discussing health issues with a healthcare provider of opposite gender. For instance, a female service user might be hesitant to talk about reproductive health with a male doctor. So understanding and respecting these cultural preferences can improve communication as well. Then we have to discuss about poor communication skills. Right. So healthcare providers must like develop their communication skills. As an example, a doctor who uses too much medical jargon might confuse a service user rather than clarify their condition. So training in clear, uh, person-centered communication can help avoid these issues. Um, So here we need to discuss about information handling and recording procedures. So proper handling and recording of service user information are crucial in maintaining confidentiality and ensuring effective care. So we have principle of confidentiality. So confidentiality means uh, that service user information should be kept private and only shared with those directly involved in their care. For example, a service user diagnosis should not be discussed in public areas where others might overhear, and maintaining confidentiality builds trust and complies with legal requirements. Then we have to understand the legislation. So it's important for healthcare providers to be familiar with laws that govern patient information, such as Data Protection Act 2018. So we can say that this act requires that a service user data can be processed lawfully and stored securely, protecting the service user personal information from unauthorized access. Then we have the access policy. So an access policy outline who can view uh, a service user record and under what circumstances they can use. So we can say, as an example, doctors may have full access to a service user history, while administrative staff might only have access to scheduling information. So this policy ensures that the service user data is protected and only used appropriately. Then we have need-based sharing. So uh, a service user information should only be shared when necessary for their care and with their consent. Uh, for example, if a service user needs to be referred to a specialist, their medical record should be shared with that specialist, but only after the patient agrees. So this ensures that information sharing is both ethical and legally compliant. So here we need to discuss about principles and practices relating to confidentiality in health and social care. So, as we all know that confidentiality is very important in healthcare practices, and understanding its principle is very important in health and social care. So, the first one is treating information confidentiality and respectfully. So healthcare provider must ensure that all service user information is handled with the utmost respect. And for example, if a patient confides in a we can say that nurse about a sensitive issue, the nurse must keep that information private and only share it with those who need to know to provide the care. Then we have just Right. So, other important bit is related with it is sharing information. So, like sometimes sharing information is necessary for the service user safety and care. As an example, if a service user is at risk of harm, healthcare providers might need to share information with other professionals such as social workers or mental health specialists to ensure the service user receives the appropriate support. Right. Here we need to discuss about the confidentiality. So, so we all have duty of confidentiality, and all healthcare professionals have a duty to protect service user information. As an example, even if a service user condition is discussed in a team meeting, it should be done in a way that maintains their anonymity, and unless sharing specific detail is absolute, we can say that is absolutely necessary for their care. Then we have what legislations cover confidentiality in health and social care. So there are several key pieces of legislation which governs confidentiality in healthcare. So the common law of confidentiality. So this principle underpins the duty of confidentiality in healthcare. For example, it prevents healthcare providers from disclosing service user information without consent unless there is a legal or ethical obligation to do so, such as in cases of public safety. Then we have, look, here they have mentioned few of the bits which are related, they have given us a example. If a girl has been a victim of female genital mutilation, then this is a criminal offense, and the appropriate authorities need to know. So we have to share the information to keep the people safe. And we have the Human Rights Act. Okay. So if we talk about Human Rights Act 1998, then we say that this act guarantees that the right to privacy, right to life, and it also include confidentiality of personal health information. For example, um, patients have the right to expect their medical records will not be disclosed with other and without their permission or consent. And the Human Rights Act 1998 has many important sections of it. We have Section 8, um, uh, we have Section 8, and also there is subsection involved in the Human Rights Act 1998. So the Human Rights 1990 Act is it's the right to respect their private and family life. It's we use it for the basic human rights. And then we have the CARE Act 2014. So this act promotes a person-centered approach to care, and it emphasizes the importance of sharing information at early stages to protect vulnerable adults, uh, or anyone vulnerable, we can say. So, as an example, if a healthcare provider suspects an elderly patient is being abused, they may need to share this information with the relevant authority to ensure the service user's safety. We have Health and Social Care Safety and Quality Act 2015. So this legislation emphasized the integration of information to improve service user safety and quality of care. As an example, it supports the sharing of service user information across healthcare settings to ensure that all providers have a complete picture of the service user needs. Then we have the Data Protection Act 2018 and GDPR. So these regulations provide comprehensive guidelines for the handling of personal data, including health information. For example, under GDPR, healthcare provider must ensure that service user data is processed lawfully, fairly, and transparently, and that it is stored securely to prevent unauthorized access as well. Right. Here, we need to discuss when can you break confidentiality in health and social care. So, as we all know that confidentiality is crucial, there are situations where it may need to be broken. So, when we can do that is protecting the best interest of the service user. So, uh, if a healthcare provider believes that not sharing certain information could result in harm to the service user or others, they might need to override confidentiality. As an example, if a service user express societal thoughts, it's important to share this information with mental health professionals to ensure the service user get the help they need. And we also have public interest. So in some cases, confidentiality might be broken to protect public safety. For example, if a service user is diagnosed with a highly contagious disease like TB, so healthcare providers might need to inform public health authorities to prevent an outbreak. Even the uh, service user wishes to keep their diagnosis private. And we have, okay. So here they have given us a scenario to discuss, and we need to imagine you are a care worker, and while helping an elderly male patient or service user, you notice there are bruises on his back. So he confides in you that his usual care worker hit him last week, but he asks you to not to tell anyone because he does not want to cause trouble. So there are some conflict. So here you are faced with a dilemma, and on one hand, the service user has asked you to keep this information confidential, and on the other hand, you have a duty to protect him from further harm. So this situation requires careful consideration of both the service user wishes and their safety. So what do you think, what any one of you think that what would be the uh, possible solution to this scenario? Any idea from any one of you in this real life incident? What we would do? Right. So what we do in this case, so it would be appropriate to override confidentiality to protect the service user from further harm. So you should explain to the service user that you need to report the incident to ensure his safety. It's important to handle the situation with sensitivity, reassuring the service user that your actions are in his best interest. Right. This was about the situation which we have discussed, what we would do in this situation. Here they have mentioned that you are acting on behalf of the man's best interest and within the Public Interest Disclosure Act. So this means we can override your duty to protect his confidentiality and speak to your manager or any authority about what you have found. Right. Here we need to discuss about factors that can influence the maintenance of confidentiality in health and social care. So we need to do the evaluation of it. So there are like we can say several factors which influence the how confidentiality is maintained in healthcare setting. So first one is ask for consent to share information. So whenever possible, service users should be asked for their consent before the information is shared. For example, if a service user information needs to be shared with a specialist, it's important to explain why this is necessary and obtain their permission. Then we have consider safeguarding when sharing information. So, safeguarding concern may require the sharing of information without consent. For example, there is a concern that a service is being, a service user, we can say that is being abused or neglected. So, healthcare providers may need to share information with social services to protect the service user, even if the service user has not given consent. Then we have be aware of the information you have. So healthcare providers must be mindful of the sensitive information they hold and the responsibility that comes with it. Uh, as an example, assessing a service user record should only be done for a legitimate reason related to their care. Then we have keep records when sharing confidential information. So uh, documenting when and why confidential information is shared is essential for accountability. For example, if information is shared with another healthcare provider, so this should be noted in the service user record, including the justification for sharing the information. Then we have to stay up to date on laws and uh, rules surrounding confidentiality. So, healthcare providers must be familiar with the latest laws and regulation regarding confidentiality. Uh, as an example, understanding the Data Protection Act 2018 or GDPR requirement ensure that service user data is handled correctly, protecting both the service user privacy and the provider from legal like repression. And then we have how do you maintain confidentiality and just right. So we will always follow if we talk about confidentiality in NHS. So confidential information about service user or patient should be treated confidentiality and respectfully. It would be the same. The laws would be the same. We will follow the GDPR and the Data Protection Act 2018. And also there would be some internal policies as well. So we need to be aware of those policies and laws. Here we have to discuss about protecting confidential information. So, uh, right, so here are some of the bullet points which we need to discuss. So, for example, we have locking away confidential information. So, physical records should always be stored securely, such as in lock cabinets and not left unattended. As an example, a service user file should be locked away at the end of the day to prevent unauthorized access. Then we have password protecting sensitive computer files. So digital records should be protected with a strong password and encryption. So for example, only authorized persons should have access to electronic health record, ensuring that service user data is secure from unauthorized access. Then we have marking confidential information clearly. So um, confidential documents should be clearly marked to ensure they are handled appropriately. As an example, file containing sensitive like service user information should be labeled as confidential, so anyone handling them knows to take extra care. Then we have uh, password, paper copies. Okay, then we have about shredding paper copies before disposal. So any paper documents containing service user information should be shredded before disposable to prevent unauthorized access. For example, when service user records are no longer needed, they should be shredded rather than simply thrown away. So we need to ensure that no sensitive information can be recovered. And the last one is we need to make sure that only confidential information is disclosed to those who need to know. For example, in case of, as we discuss about local authority or any specialist, right? So here we need to evaluate strategies used in health and social care setting to overcome barriers to communication. So overcoming communication barriers is essential for effective care. So we have again few bullet points to discuss. So we need to check whether it's a good time and place to communicate. So timing and environment are crucial for effective communication. For example, discussing a sensitive health issue in a noisy, busy environment might not be effective. Instead, we need to choose a quiet, private space where the service user feel comfortable and is more likely to engage. Then we have be clear and use language the person understand. So it's important to tailor our language to the service user level of understanding. For example, use simple, straightforward language when explaining a diagnosis to a service user, avoiding medical jargons that could confuse them. Then communicate one thing at time. Um, Overloading a service user with information can lead to confusion. As an example, when discussing a treatment plan, it's better to explain one step at a time, ensuring the service user understand each part before moving on to the next. Then we have respect a person's desire not to communicate. Okay, so sometimes a service user might not be ready to talk. For example, if a service user is upset or in shock, they might need some time before they are ready to discuss their health. So, in such cases, it's important to respect their wishes and revisit the conversation when they are more comfortable. Then we have checked that person has understood you correctly. So, we need to always verify that the service user has understood the information provided. As an example, we can say after explaining how to take medication, ask the service user to repeat the instruction back to you to ensure they have understood it correctly. Then we have communicate in a location free of distraction. So again, uh, a quite comfortable environment can make a like we can say that it makes a big difference in how well communication is received. For example, when discussing a complex treatment plan, sitting in a private room free from interruptions help the patient focus and understand the information. Then we have acknowledge any emotional responses. So it is important to recognize and address the service user's emotional reaction. For example, if a service user become visibly upset after receiving a diagnosis, we need to take the time to acknowledge their feeling, and it offers support and ensure they understand that their concerns are heard and validated. Right. So here we need to discuss about factors affecting communication. So there are a number of factors that can influence communication in health and social care setting. So we need to look at the image attached. So here are different barriers with the person ability to send or receive or understand a message. So these all are the factors that could affect a person to understand a message. So the first one is sensory deprivation and disability. So in that we can say that service user with sensory impairments may struggle with communication. For example, a service user with hearing loss may not have verbal, we may not hear the verbal instruction clearly. So, what it requiring the use of written communication or British Sign Language. So, similarly, a visually impaired service user might need information provided in braille or via audio. So, for the example, then we have foreign language and cultural differences. Right. So, as we all know that we are in the United Kingdom and it's a multicultural country. So, um, like people speak a different ethnic group, they speak a range of languages. So, we can say cultural differences uh, can lead to misunderstanding if not properly managed. For example, certain nonverbal cues might have different meanings in uh, different cultures. So, a gesture that is considered polite in one culture might be seen as rude in another. So, and also language barriers can make it difficult for patient to understand medical information. So, using an interpreter or providing translated material is essential. Then we have the dialect. So, uh, for dialect, we can say that variation in dialect can also cause communication issues. For example, a service user who speaks a regional dialect might use words or phrases that are unfamiliar to a healthcare provider from another region. So, in such cases, it's important to ask for clarification and ensure both parties understand each other. Then we have jargon, slang, and use of acronyms. So, medical jargon and slang can confuse patients so who are not familiar with them. So, what we can say as an example, for example, like telling a service user they need a CT scan might not be clear unless you explain that it is a type of detailed X-ray uh, that would help us see inside your body and more clearly. So it's important to use language that the service user can easily understand. So here we have to discuss about distress and emotional difficulty. So here they have given us examples. So some conditions such as having a stroke, being depressed or having other mental health problems may affect an individual ability to communicate. So what we need to do is we need to again like consider the issues the service user is facing, and we need to communicate the way that is understandable by the service user. So we can use, for example, again, visual hearing uh, impairments, or mm, we can use the the interpreter or translating devices, things like that. So, and like for example, if we are working in a care home, if a service user is distressed and he or she is facing emotional difficulties, then we can mm, uh, go to them in another suitable time when their mood is good. So then we can explain the things better to them. And we can say that there are some impact of emotional distress. So um, sometimes the service user who are emotionally distressed, such as those experiencing depression or fear, so uh, may find it difficult to process information or communicate effectively. So, uh, as an example, again, a service user who is upset about a recent diagnosis might struggle to focus on what the doctor is saying, so leading to misunderstanding or incomplete communication. Then we have the health issues as well, right? So there are illnesses and injury. So service user who are ill or injured might not have the energy to focus or to communicate effectively. For example, a service user recovering from surgery might be too fatigued to engage in detailed discussion about their care plan. So, in such cases, it's important to provide information in small, manageable pieces and to check that the service user has understood it. Then we have medication effects as well. So, medication can affect a service user ability to communicate. For example, certain pain medication might make a service user drowsy or disoriented, so which can hinder their ability to follow instructions or express their needs clearly. So, healthcare providers should be aware of these effects and adapt their communication style accordingly, perhaps by speaking more slowly or repeating key information. Right. So here we have to discuss about environmental problems. So we can say that a physical environment can also impact communication. So we have noisy or uncomfortable environment. So noise or poor lighting or uncomfortable temperature can make it difficult for service user and healthcare providers to communicate effectively. As an example, trying to explain a treatment plan in a noisy waiting room might result in the service user missing important information. So we need to ensure that the information we are sharing uh, is a quite well lit and comfortable environment that can improve the communication. Then we can say that lack of privacy as well. A lack of privacy can also discourage service user from sharing personal information. For example, a service user might be reluctant to discuss sensitive health issues if they feel they can be overheard by others. So, providing a private space for consultation is essential for effective communication. Here we have to discuss about overcoming barriers to communication. Right. So, what we need to do to ensure effective communication? So, we need to address and overcome barriers. So, for example, if we talk about adopting the environment, so simple changes to the physical environment can make a big difference. For example, moving a conversation to a quiet room with a good lighting can help a service user focus better on the information being shared, and it can reduce the misunderstanding as well. We can use use changing our approach as well. So sometimes it's necessary to adjust your communication style. For example, if a service user is having trouble understanding a complex concept, we might use uh, visual tools or break the information down into smaller, more manageable parts. Then uh, we can use electronic devices, so technology can be valuable tool in overcoming communication barriers. For example, using a hearing loop system can help a service user with hearing impairment and better understand what's being said, ensuring they receive the same level of care as everyone else. Then care workers can make the best of the care environment by. So sometime we need to adapt the environment for better communication. So making changes to the physical environment can enhance communication. Mhm. Again, we have brighter lighting, we can say that. So uh, good lighting is essential, especially for service users who rely on visual cues, so such as those with hearing impairments who lip read. For example, ensuring that the room is well lit can help service users see facial expression and lip movements more clearly, improving their understanding of the conversation. Then we can say that. Soundproofing rooms as well, so reducing background noise can make it easier for service user to concentrate on what's being said. For example, soundproofing a consultation room or using a quiet area away from busy hallways can help service user focus better on their discussions with healthcare providers. Then we have is minimizing background noise. So we need to reduce distractions in the environment, can help service user focus better on the conversation. Uh, as an example, turning off a television or closing a door to block out hallway noise can create a more conductive setting for effective communication. Then we have using non-verbal cues. So even in an optimal environment, non-verbal communication remains crucial. As example, um, using gestures, facial expression, and eye contact can help reinforce the message and ensure that the service user understand what is being said. Right here, we need to discuss about understanding language needs and preferences. So, right. So, to communicate effectively, it's important to understand and accommodate each service user language needs and preferences. So, using preferred language whenever possible, communicate with service user in their preferred language, either directly or through an interpreter. For example, if a service user speaks primarily uh, Chinese language or Mandarin language, so having a Mandarin speaking interpreter available can greatly enhance their understanding and their comfort. Then we have adopting the communication strategies. Mm, Right. So we need to adjust our communication style to fit the service user need. For example, if a service user has difficulty understanding spoken English, so we might use visual tools, written materials, or even learn a new or few basic phrases in their language. Uh, what it will do, it will help bridge the communication gap if it's possible. Then we have uh, some basic, right. And also we could learn some basic sign language. So for service user who use sign language, healthcare providers can enhance communication by learning basic signs. For example, knowing how to sign common phrases like "Are you in pain?" or "Do you need help?" So that can make a difference in how effectively we communicate with a deaf patient or service user. Then we have to discuss about the pace, right? So pacing your communication is key to ensure that service user understand and can respond appropriately. So what we need to do is speaking clearly and slowly. So when communicating complex information, it's important to speak slowly and clearly. Then we have repeating and rephrasing. Mm, Right. So if a service user seems confused, it's helpful to repeat or rephrase the information. As an example, if a service user does not understand a medical term, we need to try explaining it in a simpler language or using a different analogy that might resonate better with them. Then important bit is allowing time for response. So it's important to give service users time to process information and respond. For example, after explaining a diagnosis, we need to pause and give them a moment to absorb what you have said before asking. If they have any question, this approach ensures that the service user fully understand and can engage in the conversation. Then we have electronic devices. So in this modern world, so electronic devices can greatly assist in overcoming communication barriers. So for example, we have text phone or text uh, phone devices. So what it does, it allow individuals with hearing or speech impairment to communicate over the phone by typing messages instead of speaking. So then we have hearing loops. Hearing loops amplify sound for individuals with hearing tools and helping them to hear more clearly in noisy environment. For example, in a busy clinic, a service user with a hearing aid might use a hearing loop to better understand their consultation with healthcare provider. Then what we have, that's it. Okay. So now here are the references. Uh, these are the references which were used in this presentation, and you can also go through with these references to understand some concepts. Then what we have left, right? Okay. So I'll conclude today's session. So In today's session, what we did is we talk about in-depth journey through the vital aspect of effective communication in health and social care. We started our lesson by exploring the fundamental importance of communication in forming a strong relationship, improving collaboration, and supporting patient-centered care or uh, person-centered approach. So, through how we can do that is we discuss about through verbal communication, non-verbal communication, and written communication. We learn how to convey clear and accurate messages that can impact the service user outcome. We also discuss about the barriers that hinder effective communication. We discuss about language differences, sensory impairments, emotional states, and environmental factors. Uh, we also discuss about confidentiality. So, confidentiality is important, and it's very important factor in ethical and legal responsibilities. We have to protect the service user information. So we also discuss about uh, how different tools such as British Sign Language and technological devices can enhance communication with service users who have specific needs. We also discuss about practical strategies for communication, um such as the environment, and we also discuss about the pace and emotional state. So, as we wrap up, we need to remember that effective communication is not just about transmitting information, it's about understanding, empathy, and collaboration. So, it's about ensuring that service users feel heard and respected and supported. So, when we apply these principles and strategies, we can enhance the quality of care we provide. We can build a stronger relationship with service user and contribute to better health outcomes. So if any one of you have any question, no questions. So in the end, I'll say that I encourage you all to review the materials and resources provided and reflect on the strategies discussed and think about how you can incorporate them in your daily practices. So your role in health and social care is very crucial, and mastering the art of communication will help you make a positive impact on the lives of those you care for. And again, I look forward to seeing you the uh, positive effect of your enhanced communication skill in your professional practice. And you will meet next week then, and we'll go through with the learning outcome 3. So till then, everyone, please take care.
Thank
Bye.
you.
Thank you, everyone. Bye.